Healthcare financing is becoming more difficult for governments and individuals due to the rising cost of goods and services. And in order to reduce the burden of healthcare on families, Katsina state government has successfully registered more than 309,000 people in less than a year of its takeoff. Abdullatif Yusuf examines the impact of the contributory health scheme, which has become the largest in the country.
Qualitative health care for all is a dream many governments have desired to translate to reality for their people, but many do not succeed despite the United Nations Declaration of Universal Health Care for All. Nigeria is one of the most populous African nations and it still battles to provide qualitative health care for its people. This is in spite of a series of health reforms geared towards alleviating the health challenges faced by its citizens. Recently, most states, Katsina included, have been able to put in place health reforms that have led to the establishment of state contributory healthcare management agencies to tailor healthcare insurance cover to all its indigents.
The executive governor of Katsina State flagged off official enrollment exercise of the formal sector program of the scheme. To date, we were able to register 93% of the total labor force under the formal sector contributory scheme. Within the 69,000 enrollees that we have, or principals that we have, we are able to cover their spouses and 4 biological children below the ages of 18 for each and every enrollee or beneficiary into the scheme. And that sums our enrollment to be 309,000 as at today.
Katsina State Ministry of Health is saddled with the responsibility of actualizing the state health restoration reforms. Its permanent secretary gives an overview of the health agenda of the Masari government and where the state stands in its resolve to attain universal health care for all.
So if you look at all these programs that I'm saying, from what the state is doing, from this contributory healthcare management agency, from the basic healthcare provision fund, we are in the health sector expanding the base of care to those that need to have that care. So gradually, as we are expanding, more people in the populace are accessing care without ado to the financial run cost of having to pay for that service, and ensuring also, most importantly, there is quality in that care.
The result is the establishment of the largest social welfare health scheme in the country, providing for a population already devastated by insecurity and poverty. Its benefits are enormous because before now, many would have rather spent their little earnings on food rather than going to the hospital.
And we have identified key areas of support that each state health insurance needs. And NHIS is designing a targeted capacity building plan that is going to be implemented to improve these areas that they have identified as their problems. Some of the key areas have to do with the issue of ICT, integration of data, MIE, claims management system, among others.
This opportunity to call on workers that this scheme, as the name drive, contributory health scheme, is a collective support and effort of each and every worker to contribute so that at the end, workers can go to any health facilities of their choice, access care without spending from their pocket.
The management of resources and prompt supervision of health providers are key issues that must be well handled in order to meet up with the United Nations Declaration for Universal Health Coverage. What could have been the plight of the vulnerable groups and even the low-income earners without health insurance cover?
So the capacity of this agency to enroll 8 million citizens of this state is going to be achievable. Why did I say this? Because we have a robust ICT platform that can register as much as we can. We have those civil servants working with the federal government under the National Health Insurance Scheme. We have those working with the state under the formal sector contributory scheme. And we also have those from the informal sector.
We are working in synergy with the Katsina State Contributory Health Care Agency to ensure that we improve and make services available, especially at the primary healthcare, which is the bedrock of healthcare delivery in the nation.
This is why bringing the contributory healthcare management under one roof is also being proposed to promote synergy between the states, the federal government and the donor partners. As the world celebrates the UN Day set aside to create more awareness and also remind authorities of their responsibilities to provide healthcare for all, it is equally important for citizens to understand their role in getting things done rightly for a better result. Abdullatif Yusuf, TVC News, Katsina.